My name is Takács. I'm working at the Department of Community Dentistry. My mission is to improve the patient satisfaction with implants, while my vision is the application of the augmented reality-based navigation system in implantology in the everyday clinical practice. To achieve this, these are my two topics. These are systematic review and an in vitro study, and I would like to talk about these detailed. So the first one is about investigating the accuracy of different implant placement techniques. All in all the current implant placement methods in clinical use have their own drawbacks. For example, the freehand method may have a prosthetically inadequate implant position, iatrogenic damage and aesthetic complications appear more often. The conventional dynamic navigation systems need the surgeon to alternate attention between the monitor and surgical area, also causing iatrogenic damage. And all in all, the static navigation system needs surgical guides, and these guides require additional space, and also they endanger the cooling of the drill. So as a solution to these problems, I would like to introduce the augmented reality-based implant placement to you. It's based on the superimposition of the preoperative plan on the surgical area, and it doesn't require the fabrication of a surgical guide, and surgeons have a full visual control while placing the implants. So all these drawbacks I mentioned earlier can be avoided. So the clinical question of this study would be what is the accuracy of the AR-based navigation system and also all these existing navigation systems. And as a hypothesis, we expect the accuracy achieved with the AR-based dynamic navigation system to be better than the other methods. The clinical implication of this meta-analysis is to decrease complications and iatrogenic damage and to achieve a better biomechanical and aesthetic result. Here you can see my search key and also the results of the searches from the 3 databases and the flowchart of selection. After the full text selection, we had 86 articles left. My second topic is an in vitro study, MSc students' learning curve of augmented reality-based and conventional dynamic navigation implant placement. So, as I mentioned earlier, unlike the dynamic navigation, the augmented reality-based navigation allows us a full visual control, and this way it may allow less iatrogenic damage, less aesthetic complications. The reason we would like to conduct this study is because we would like to see a learning curve for augmented reality-based navigation, as there hasn't been any articles coming out about this theme. So just to show you what a learning curve is, I would like to show you this example. On the x-axis, you see the implants placed by numbers. And for each implant placed, there is an operation time. And from the measured operation time, it gives us a curve, and this is what we call a learning curve. So in this figure, you see 2 learning curves. This is why there are 2 lines. So the clinical question of this study, what is the learning curve and accuracy of dental implant placement using these 2 methods? Our hypothesis is that the augmented reality-based navigation will be faster to learn and faster to reach clinically acceptable accuracy than the conventional method. As an implication, we would like to offer an easy-to-learn implant placement method and also decrease complications, iatrogenic damage the same way, and achieve better biomechanical and aesthetic results. So we would like to include MSc dental students in this study, and we would like to conduct the implant placements on 3D printed resin models of human mandible. We would like to exclude everyone who has any previous experience in implant placement. Here are the two arms, the augmented reality-based dynamic navigation and the conventional dynamic navigation system. And we would like to divide the students into two teams. Half of the students would start placing implants with the AR-based navigation, and after that, proceed with the dynamic navigation. The second team would do everything vice versa. We would like to do the measurements of the learning curve based on 10 time points. So for one student, it would mean 4 implants per time point. And this way get 4 learning curves. The reason we would like to conduct this experiment this way is because we would like to see if there is a difference in the results in case of having a previous knowledge of the other navigation technique. You can see here my outcomes. We would have only primary outcomes, the learning curve itself, which would be measured by the operation time in seconds, and also the implant placement accuracy with the angular deviation, apical global deviation, and coronal global deviation. So as an overview of my aims, I would like to finish my first project by the end of July, and the second project by the end of August. And thank you for your attention.
I would like, or I'm interested in first 2 questions basically. First, how do you investigate the accuracy of implant placement? And then also, how do we know what is more accurate? What is the comparison? If we just investigate and look at 2 different methods on how to put the implant in, how do we know in the end? So if we see, okay, we can see there's a difference, maybe between 2 different techniques, but how do we know then in the end that this is more accurate or more like how it should be naturally be?
Thank you for the question. We are measuring accuracy, first of all, by comparing virtual plan to the exact implant positions. So we would superimpose the 2 pictures. And these deviations I've been talking about are measured with different points on the implant. For example, the apical global deviation is measured by comparing the most apical point in the center of the implant, the planned and the placed version. They are comparing the 2 to each other. And this is how we get deviation data. The same is true about the coronal global deviation. It's just the most coronal point at the center of the implant, and the angular deviation is measuring the difference between the 2, the planned and the placed implant axes. So these are the data, and technically, when you are like placing an implant with a static or a dynamic method or even AR, you are doing the same measurements with the same points, and this is how you see. So the smaller the deviation, the better the implant placement accuracy is. Ideally, it would be 0, and then you can see which one is better.
Thank you. Did I see correctly that there were two students in each group for the second project part?
Yes. This is actually a draft number. So we've been checking previous studies on this theme, but we haven't done a sample size calculation.
because it seems too low, especially if we consider that even among these students, let it be MSc students, they might be quite different in dexterity from the beginning. So can it be introduced an initial test for them, how far they are from each other in general accuracy of dexterity?
We haven't planned any previous tests for these students, but thank you, and we will take this into consideration.
On that sense, you're not planning previous education for those students, right? They would go straight to the implant placement. Wouldn't they have any previous education on that?
Well, obviously we would tell them how the system works, but we were planning to measure it from the first implant they have ever placed. So we were wondering about starting the study with students totally new to this technique. So no previous knowledge, or, well, not knowledge, but practical knowledge, I would say.
Thank you very much for your presentation, Anna.
Thank you.